Hi everyone, welcome to today's talk on an integrative or functional medicine approach to ADHD. I hope you find this talk useful. To meet the criteria for ADD or ADHD, 6 or more of the following symptoms of inattention and/or hyperactivity impulsivity needs to be present for at least 6 months to a degree that is disruptive. On the inattention category, the first one is difficulty with details. The next one is sustaining attention, listening challenges, following instructions, organization problems, avoidance of sustained effort, losing necessary items, and easily distractible, and forgetfulness. On the hyperactivity impulsivity categories, fidgeting or squirming, difficulty remaining seated, inappropriate running or climbing, difficulty with quiet play, on-the-go behavior, excessive talking, blurting out responses, difficulty waiting turns, interrupting or intruding. Besides meeting 6 or more of the criteria from the list, there are additional criteria requirements for the diagnosis of ADHD. The first one is the onset of the symptoms must happen at an early age before 7. There needs to be impairments across settings, not just at one setting, but 2 or more, such as school and home. There needs to be functional impairments, either in social, academic, or occupational functionings. And it is a diagnosis of exclusion, excluding other mental disorders such as mood disorders. To look at the causes of ADHD, we should remember that it is an interplay between genetics and environmental factors. Remember, genetics loads up the gun, environment fires it. There is a high heritability of 80% in extensive family, twin, as well as adoption studies. The genetic influence seems to be polygenetic, meaning there are tens to hundreds of common genetic variants, each contributing a small effect that collectively increase susceptibility to ADHD. And many identified genetic markers include neurotransmitter systems, especially dopamine, such as DRD4 and DAT1. These dopamine receptor genetic variants are responsible for reward processing, attention, and executive functioning. On the environmental side, there are prenatal and perinatal influences such as maternal exposure to tobacco, alcohol, or drugs, prematurity, low birth weight, especially less than 32 weeks of gestation, and chronic maternal illness. Environmental toxins such as lead toxicity, pesticides, and other neurotoxin chemicals have been postulated to contribute to the environmental causes of ADHD. Nutritional and metabolic factors such as deficiencies in essential fatty acids and other nutrients, sensitivity to synthetic additives or certain foods, and reactive hypoglycemia, they all can contribute to the causes of ADHD that are environmental. There is an intriguing theory in evolutionary psychiatry that tries to explain why ADHD genes has flourished in humans. This theory, that is based on hunter versus farmer hypothesis, states that traits associated with ADHD may have offered advantages in early human environments. For example, these genes might have helped us as we were migrating from Africa. These genes offered advantages such as strong high-stakes focus and rapid threat response and hyperactivity that supported physical readiness and mobility. Also, according to this hypothesis, as human modern society moved from a hunter-gatherer to agricultural communities, these behaviors that were essential for survival became less aligned with the demands of structured, sedentary, and routine-based environments. So what is the prevalence of ADHD in US children? According to the census from 2025, 7.1 million, or approximately 11.4% of the pediatric population, is diagnosed with ADHD. And there are 3.5 million children currently on ADHD medication. This number has been steadily rising from 1960s and 70s. And the possible explanation for rising ADHD diagnosis could include improved identification. We are better at recognizing ADHD symptoms. There is a true increase in prevalence due to genetics, environmental, or social factors. There is a broader diagnosis criteria, so more individuals qualify for diagnosis and treatment. Or there might be an overdiagnosis issue where children may be diagnosed and treated for ADHD when they do not meet the full criteria. If we were to look at an integrative and comprehensive management approach to ADHD, we should remember that this approach emphasizes the whole child, addressing biological, behavioral, and environmental factors together. First step is accurate diagnosis to make sure we are ruling out mimicking and coexisting conditions, using standardized rating scales and clinical interviews with input from both parents and teachers. As the initial approach, behavioral approach is the most important. Implementing structural behavioral therapy, focusing on attention, impulse control, and emotional regulation. Reinforce positive behaviors and teach coping strategies. Home, family, and school interventions are very important. Collaborating with parents, teachers, and counselors to create consistent expectations and routines. Adjust classroom environments and teaching styles to support focus and self-esteem. Medication can be used if needed. Both stimulants and non-stimulants can be implemented if behavioral and environmental interventions are insufficient. These medications need to be monitored for efficacy and safety. Other approaches that are emphasized in the integrative medicine approach is gut health, diet, and nutrition. We need to evaluate for food sensitivities, dysbiosis, and gut inflammation. Use elimination diets or probiotics when clinically indicated. Emphasizing balanced meals with protein and complex carbs to prevent reactive hypoglycemia. Limiting artificial dyes, preservatives, and high glycemic foods. And of course, exercise is encouraged. Other integrative approaches could include vitamins, minerals, and nutritional supplements, nutrients such as magnesium, zinc, iron, and omega-3 may have a potential role in attention and mood regulation. Supplements may help when dietary deficiencies are confirmed or postulated. Herbal or botanical approaches in some children can help. In some children who are unable to take medications or do not want to take medications, EEG neurofeedback, which is a non-invasive technique, can help to improve attention and impulse control. Homeopathy remains limited in research and is inconclusive, but some families may explore it as an adjunct to the ADHD treatment, but it will not replace evidence-based medical approaches. In our clinic, we start the evaluation by an initial clinical interview that lasts 50 to 60 minutes, followed by a 75-minute treatment planning sessions and additional follow-ups as needed. We try not to only interview parents, but the child if possible. We use standardized rating scales, such as a Vanderbilt assessment scale that is completed both by parents and teachers. May order some laboratory testing to better assess the contributing medical conditions, review prior evaluations that have been done, and may refer for new testing, such as order psychoeducational evaluations when additional cognitive, academic, or neuropsychological information is needed. Let us look at some conditions that commonly can be misdiagnosed as ADHD. PTSD or post-traumatic stress disorder with the trauma-related hyperarousal, distractibility, and emotional reactivity can resemble ADHD symptoms. Certain mood disorders, including depression, bipolar disorder, and anxiety, can also mimic some of the symptoms of ADHD. I should mention that about half of children who are diagnosed with ADHD have a mood disorder as well. Learning disability, where the child is struggling, can appear as inattention, while the underlying issue is cognitive or processing related. A child who is gifted with may come across as high curiosity, intensity, or boredom, which can be misinterpreted as hyperactivity or distractibility. Children who are intense or have difficult temperaments, strong-willed, or highly reactive may display behaviors that resemble impulsivity. And lack of engagement or boredom in non-challenging environments can lead to restlessness and inattentive behavior. Let us look at behavioral approaches as the cornerstone of any treatment for ADHD. The behavioral approaches are effective with or without medication, and behavioral interventions can significantly improve functioning on their own and often enhance benefits of medication, supplements, and diet. These approaches need to be realistic, observable, and measurable. Goals should be concrete, trackable, so progress can be clearly identified. For example, completing homework independently. A typical treatment goal plans could include better school and work completion, increased independence in homework and self-care, strengthening self-esteem, etc. If progress stalls or goals are not being met, the plan may need to be adjusted to better match the child's developmental level, environment, or support needs. So why do children with ADHD benefit from structure? Kids with ADHD don't just benefit from structure, they thrive on it. Consistent structure helps to reduce cognitive load and makes expectations predictable. Firm, calm limits provide safety and reduces impulsive behavior. Positive reinforcement strengthens desired behavior far more effectively than punishment. Many families describe cycles like good year, bad year with their children. The reason is almost always the same: teacher fit. A great teacher provides structure, warmth, clarity, and predictable routines. Some classrooms are naturally ADHD friendly. The others are overstimulating or inconsistent. When expectations are clear and reinforced positively, kids succeed. A single excellent teacher can transform a child's entire year and even life. Let us look at a clear example of how behavioral intervention at school can help children. Tolson School System, which is a school in Tucson, Arizona, started a program called the Nurtured Heart Approach. Let's get some context into this school. The school is approximately 75% of students come from low-income families, and the entire school adopted the Nurtured Heart Approach. The core principles were behavioral management system emphasized positive feedback, clear rules, and consistent consequences. The focus was on recognizing success, building inner strength, and creating emotional safety. Teachers and staff reinforced positive choices rather than reacting to negative behavior. The impact of this approach on the children's behavior and school performance was remarkable. There was a dramatic improvement in student behavior across all grade levels. Special education enrollment decreased from 31 students to 7 students. That is a reduction of 77%. This suggests that improved behavioral regulation and fewer students are being misidentified as needing special education services. Also, medication use nearly eliminated. Only 2 of 519 students are currently on ADHD medications. That's 0.3%, which is an extraordinarily low level for US elementary school. Tolson is now recognized as Performing Plus school. Standardized test scores have shown consistent year-to-year improvement. Teachers attribute gains to improved focus, emotional regulation, and classroom climate. There are different types of medications that can be used in the treatment of ADHD. Stimulants are the most widely studied and commonly prescribed medication. For ADHD, they include methylphenidate-based medications such as Ritalin, Concerta, Focalin, and Metadate. There are mixed amphetamine salts such as Adderall, D-amphetamine formulations such as Vyvanse and Dexedrine. There are non-stimulants that can be used at times where stimulants are not effective or not tolerated, and they include Strattera, Qelbree, Intuniv, Clonidine, and there are other medications that have off-label use for targeting attention, mood, and impulse control, and they include Wellbutrin and tricyclic antidepressants. Different medications could have potentially different side effects in some patients. They include decreased appetite, which are common with stimulant medications, could cause sleep disturbances or somnolence. In some cases, could cause mild stomach discomfort. Headaches, often transient, can happen, and these headaches can improve with dose adjustment or timing of the medication. Tics, rare but can happen. Behavioral changes, including irritability, emotional lability, and unusual behaviors may occur in sensitive individuals. And in very rare cases, hallucinations can happen. In general, the side effects stop when the medication is stopped. In the treatment of the ADHD, gut health, diet, and nutrition plays a very important role. Maintaining a normal blood sugar is very important in a lot of the cases. Table sugar, syrups, sweetened drinks, desserts, etc. could cause a rapid spike in blood glucose. These spikes can lead to crashes, irritability, fatigue, and further cravings. Processed carbohydrates like white bread, crackers, chips, pastries, and many cereals break down quickly into sugar and cause a similar kind of reaction. They raise blood sugar almost as fast as eating straight sugar. And ultra-processed foods, mainly packaged snacks, fast foods, frozen meals, and refined grains often contain added sugar, refined starches, and industrial oils, which all can cause issues with spike in blood sugars. So why is the raise in blood sugar so important? A child that starts the day with a breakfast containing no protein, no healthy fat, and a high glycemic index experiences a rapid blood sugar spike. This increase in the sugar spike triggers a strong insulin response, which causes a sudden drop in the blood sugar levels, often below baseline, and the body interprets this as a stress signal. Stress hormones are released, including adrenaline, which in turn raise the blood sugar almost as fast as eating a straight sugar diet. And the adrenaline causes a stress response, which includes increased heart rate, heightened arousal, and physical restlessness. So a child that has consumed a high glycemic breakfast midday can experience a behavioral shift, which is caused by low blood sugar, high adrenaline. It causes jitteriness, fidgeting, and poor sustained attention. To a teacher, this looks similar to ADHD, with difficulty sitting still, distractibility, impulsive control, and inconsistent focus. This high glycemic breakfast is even more important as we deal with kids who are ADHD prone. So kids who already have ADHD symptoms, the unstable blood sugar may intensify their symptoms. They could be more impulsive, more restless, more emotional reactivity. And this does not mean diet causes ADHD, but it can amplify behaviors that resemble or worsen ADHD. Let's look at a practical example of the effects of healthy diet on a child's behavior in school. A very good example is Appleton Central in Wisconsin. This is an alternative charter high school serving students struggling in conventional settings. The nutritional intervention included giving these children healthful breakfast and lunch, focused on whole foods, fresh fruits and vegetables, balanced meals with protein and healthy fats, and changing the environment, including removing vending machines. The results of the Appleton Central nutritional program was very striking. They reported better performance academically. The students showed improved focus, steadier energy, and more consistent engagement in class. There were fewer behavioral problems, including less classroom disruptions, improved emotional regulation, and more cooperative peer interactions. There were less fightings and less drug use. Another factor that affects behavior related to diet and nutrition are artificial colors, flavors, and preservatives. Research continues to show that certain food additives can increase hyperactivity in children, even those without ADHD. In a landmark study, which was a double-blinded, placebo-controlled trial, 273 hyperactive 3-year-olds were placed on a diet free of artificial colors and preservatives for a while. Then they were given either a daily drink containing the food colorings and sodium benzoate, or a placebo drink free of these artificial colors and preservatives. And the key findings showed that there was an increased hyperactivity when receiving the active mixture compared to placebo. This study is one of the clearest demonstrations that food additives can directly influence behavior. So the big culprits to watch for are artificial colors, especially red and yellow dyes, preservatives such as sodium benzoate, and artificial flavorings such as MSG, artificial vanillin, and artificial buttery flavorings. High salicylate natural flavorings can sometimes cause an issue. They include natural flavorings of mint, almonds, berries, grapes, and oranges. If you're looking for a diet to follow, one of the better ones is called the Feingold diet that eliminates most of these culprits. When it comes to flavorings, it is best to eliminate ambiguous flavoring labels from the foods. They include labels such as natural flavor, artificial flavor, spices when unspecific. The reason is because these labels can hide synthetic compounds, salicylates, or preservatives that may trigger behavioral symptoms. Instead, use whole unflavored ingredients, pure vanilla bean paste, real fruit infusions, and simple herbs and spices with clear labeling. Of all preservatives, sodium benzoate has been the most studied and seems to be the most troublesome regarding behavioral issues. Sodium benzoate is a preservative commonly added to soft drinks, to fruit drinks, to pickles and condiments, packaged snacks, shelf-stable baked goods, and many kids' foods. It prevents mold and bacterial growth, but in some children, it can also affect their behavior and attention. How sodium benzoate affect behavior? There are different theories on how this happens. There seems to be an increased hyperactivity in sensitive children, especially when it's combined with artificial food colorings. This effect was not subtle. It was measurable across multiple behavioral rating scales. It has been theorized that sodium benzoate may affect neurotransmitter activity. Emerging research suggests that it may influence dopamine pathways, oxidative stress levels, cellular energy metabolism. These pathways are also involved in attention, impulse control, and emotional regulation. And as stated, they often act synergically with artificial colors and flavorings, such as red dye, yellow dye, and other artificial flavorings. Why is it so hard to remove sodium benzoate from the diet? The main reason is because it's hard to identify. It hides in many foods under labels like preservatives, benzoates, natural flavors. Yes, it can be included under this umbrella as well. So this makes it difficult for parents to know when the child is consuming it. During an elimination diet, remove all sodium benzoate from the diet. Avoid ambiguous flavoring labels. Use whole unflavored ingredients. And this helps to ensure the child is not exposed to hidden synthetic compounds that could confound the results. Another factor in diet and nutrition does not have anything to do with dyes, preservatives, or stabilizers in the diet, but rather food sensitivities to whole foods. Several well-designed scientific studies show that some children with ADHD experience significant improvements in symptoms when foods they are sensitive to is removed from their diet. This does not mean food sensitivities cause ADHD, but for a meaningful subset of children, certain foods can worsen hyperactivity, impulsivity, and inattention. Top whole food triggers are dairy products, gluten, soy, eggs, corn, citrus fruit, and chocolate. These foods are not bad foods, but in sensitive children, they may trigger increased restlessness, mood swings, irritability, difficulty focusing, and sleep disruptions. Why this matters? For children with ADHD or a predisposition to ADHD, inflammatory or immune-related reactions to certain foods may increase hyperactivity, reduce attention span, heightened emotional reactivity, and worsen impulsivity. Let's look at a couple studies that were done looking at food sensitivities and ADHD. In study number 1, that was reported in 1994, 19 children were reported had improved on multiple food elimination diet. 16 completed a double-blind placebo-controlled food challenge. Symptoms were noted to be significantly better on the placebo days compared with days when they consumed their trigger foods. A bigger study and more important one was reported in Lancet in 2011 called the Inca trial, where they randomized 100 children ages of between 4 to 8. It was a two-phase protocol. In the first phase, they took 50 children of that 100 and put them on a 5-week elimination diet. They only gave them rice, meat, vegetables, pears, and water. And the other 50 children were on a regular diet that served mainly as a control. 64% of children on the elimination diet showed significantly improved behaviors and symptoms of ADHD. Phase 2, that was a double-blinded food challenge. The key findings were there was a direct link to trigger foods. There was a significant improvement on a placebo. 63% experienced a significant behavioral relapse when given real foods versus placebo. Relapse occurred regardless of the IgG levels. That is a test that is performed to look at potential food allergies. Conclusion was the IgG-based tests are not reliable for identifying food triggers. Behavioral reactions reflect non-allergic hypersensitivity, non-classic immune allergy. A meaningful subset of ADHD children show substantial improvement on carefully supervised elimination diet. There are less common foods that can trigger reaction in some children. Foods that are high in salicylates and amines in some children can trigger behavioral issues. If you are doing an elimination diet and you're not getting the results you want, then you might want to look at low salicylate and amine diet as the next step to take, looking at triggers of behavior related to diet. As stated before, nutritional supplements could play an important role in the treatment of ADHD symptoms. They include vitamins, including certain B vitamins. They include minerals such as zinc and magnesium. They include omega-3 fatty acids. Amino acid therapy in some cases could be beneficial. Certain botanicals and other supplements from other medicinal disciplines such as Ayurvedic medicine or Chinese medicine can be useful. Let's look at the role of omega-3 as an example of supplements that can help ADHD. In clinical trials, approximately 45% of randomized controlled trials report statistically significant improvement in global ADHD symptom scores and quality of life measures with omega-3 supplementation. It's also been reported that 38% of children with ADHD have a lower red blood cell omega-3 levels compared with neurotypical peers. There seem to be genetic factors involved. 60 to 70% of children with ADHD carry a variant of a gene that impair conversion of standard dietary or plant-based fats into omega-3s. And we know omega-3s are essential for dopamine signaling, neuronal membrane fluidity, and executive function pathway. In a Oxford Durham study in 2005, they studied the effects of omega-3 supplementation. There were 117 children ages 5 to 12 with developmental coordination disorder, prominent ADHD-related symptoms, and they were enrolled in the randomized double-blinded placebo-controlled trial. Children were randomized to receive a 3-month omega-3 and omega-6 blend, mainly fish oil and evening primrose oil, followed by a 3-month crossover phase. The key findings were there was no difference in motor skills. However, there was a significant improvement in reading and spelling, and the teacher-related ADHD symptoms improved significantly. When the placebo group crossed over to the active treatment, they showed the same magnitude of improvement, confirming the effects. So omega-3 supplementation does not act like a stimulant, and prescription stimulants onset is 45 minutes, but the omega-3 supplementation might take 12 to 16 weeks of daily intake for neuronal membrane remodeling and behavioral changes. Exercise and physical activity is another important component of the treatment. It helps with the overall well-being of the child. It relaxes the mind and the body and enhances concentration and improves mood regulation. Exercise alone does not provide full relief from ADHD symptoms, but it is most effective when used as part of a comprehensive treatment plan. Another important tool in our treatment toolbox is EEG neurofeedback. The theory behind this treatment is that the children with ADHD often show predictable quantitative EEG abnormalities, and these abnormalities can be corrected through neurofeedback. And modern clinical trial designs increasingly use neurofeedback to reduce stimulant dose requirements or shorten the time to behavioral stabilization. When paired with medication, improved brainwave self-regulation can help clinicians achieve stability with lower stimulant dose, potentially reducing side effects such as sleep disturbance and appetite suppression. The evidence suggests that at least 20 to 40 highly consistent neurofeedback sessions are needed to produce objective, durable neurocognitive changes. Shorter or inconsistent treatment schedules are unlikely to yield meaningful or lasting improvements. So the take-home message from this talk is make the correct diagnosis, make sure that we are not overdiagnosing ADHD, not mistaking diagnoses such as stress, PTSD, learning disability, and mood disorders as ADHD. When the diagnosis is made appropriately, then seriously consider non-pharmaceutical options, either as part of or as the initial phase of treatment. Make sure there are behavioral strategies, environmental adjustments that are implemented at the same time. Look at the nutrition, sleep optimization, exercise, and targeted nutraceuticals, which in many cases could be very effective and effectively manage the symptoms of ADHD. And if the medications are needed, they need to be used sparingly and only as needed.